I think that we've started a lot of discussions about how to measure progress, and they're going to continue in the days and weeks afterwards. I'm going to be part of that, Terry Fulmer definitely, and I'm sure others will be contributing as well. But what I wanted to talk about was, how do we make progress? We're gonna sort of define what progress means and how to measure it, but how do we actually get there? And I want to throw out a framework for thinking about that work, and invoke the phrase social capital for reasons I think will become clear. I do believe that approaching this work with the same kind of intensity and discipline that CFOs bring to financial capital is the right way to really do more, to go from rhetoric to actually, a better society, a better healthcare system. The figure on the right in this, some of you will recognize this is from a social network diagram that comes from the Framingham study. It was the famous paper by Nicholas Christakis in 2008 in the New England Journal of Medicine, where they mapped out, not just blood pressure and that kind of thing in the Framingham epidemiologic study, but they asked people, who are your friends? And who are your friends? And they would keep track of, if someone said so-and-so is my friend, and that person said the other person is my friend, that would be a strong connection. And they found that obesity spreads from person to person in the same patterns as infectious disease. So some of you will remember the finding that from this paper that if a friend of yours gains weight, you are more likely to gain weight even if you don't know the friend of the friend, because norms are developing around us all the time. Social capital is often described as harnessing the power of social networks in order to accomplish your goals. And you have social networks within the people you work with. Those of us who are in healthcare, we have social networks in the patients we take care of, including their families and friends or society. How do we actually systematically harness them with the kind of rigor that a CFO brings to money in order to make progress? That's the case I want to make here. Now, I think it's an imperative for our time. And I know from our conversations, many people in this room, a much higher percentage than in most society, are familiar with Bowling Alone and Robert Putnam's work. This is his book from the year 2000. For those of you who don't, the title comes from the fact that there are more Americans bowling than ever before, but bowling leagues have collapsed because people are not joining things. They're not participating in groups and clubs. They're actually, 90% of Americans still say they believe in God, but attendance and membership in churches and synagogues and mosques is way down. And it was striking in the first part of this program how many vignettes of successful aging revolved around churches. There's actually a wonderful documentary movie on Putnam and his work that just came out. It's on Netflix, Join or Die. And it gives the message that if people don't actually participate in social networks, the consequences are enormous. Now, the data show that since the 60s, mid-60s, social connectedness has been going down. It's gone up and down in history, and in times of crisis like the Depression, World War II, and at times when there's less inequity, people feel more like they're in it together, social capital goes up. But it's been going down for the last half century. Putnam points out, in the movie Join or Die, that when people don't participate in associations, they lose social skills. They learn, he says in the movie, this isn't me making a political statement, but he said, if people are in a group and the group elects a president, they know they've got to go with it. They can't just be saying it didn't happen, I'm pretending it didn't happen. We have the consequences of that going on. We see it all the time. Social network gatherings, they tend to be, you're kind of getting together with people, but it's being defined by who you hate and who you make fun of, and which is different from being part of a club. We have loneliness in life, and it's not just driven by political stuff. It's air conditioning makes people lonely. Cell phones make people feel lonely, and then all of these things have a definite negative impact on health. The Surgeon General, Vivek Murthy, who trained with me at the Brigham long ago, he has been he's been obsessed with this. So his Surgeon General's report on loneliness, I think, is a very important document for this discussion. Impact on health, impact on healthcare costs. Meanwhile, for those of us working within healthcare, many of the people in this room, I think we know that there's a version of bowling alone that we have in addition to the societal things going on, that medicine has become so complex, so busy, but it's kind of lonely. You're working by yourself. You're staring at a computer screen, reacting all day long, and you're not necessarily thinking, the kind of thinking that you do in a group, where you have someone who challenges your reaction. And so there are all of these things that are working against social connectedness. I think that actually working positively to build social capital, the extent to which people are connected, is an important part of our work. And in fact, like the line that I'm using, it's not a line, but it's what I really believe, is that every manager and every caregiver should think of themselves as being the CFO for social capital and be every bit as intense and disciplined as the CFO of Northwell is when it comes to money. All right, so I got a book coming out on this in 2 months, and so let me just say a little bit intellectually about what social capital is. Capital is anything that gives you an advantage. An advantage over your competitors, an advantage over yourself. Like if you want to be better next year than you are now, you need financial capital to help you build things, human capital, people that will enable you to do things, people with the right training. Social capital is how those people interact with each other and with their infrastructure that enables you to do things you couldn't otherwise do. There are currencies to social capital. I'm trying to take this from a nice to have to a must have, so that you can go from thinking about some of the lovely stories of successful aging we heard early on to saying, we should be highly reliable about this is what we're trying to produce. So there are currencies that are every bit as real as money. I mean, when you think about what is money, money is not real. It's a theoretical thing. I think trust, teamwork, high reliability, these are currencies that we have to think about building. And when we're hemorrhaging them, we have to respond. Social capital is most critical when work is complex and when organizations are complex. When you're dealing with, if you're in a simple organization and a simple product, you just have a boss telling someone what to do and they've got to do it. But when you're doing something complex, as we are in healthcare and in other ways of taking care of the aging, then social capital really matters. I actually feel like it's more important than financial capital because, you can always get money from the outside, but no one can give you teamwork and trust and respect. You have to do that yourself. I would add that bullet point there, the second bullet point, which is that we are in a time that I don't think will ever end, where financial capital and human capital are going to be constrained. And what this means is that for organizations like Northwell and other organizations that are here or watching, we have to hit it out of the park on social capital. That is under our control and influence more than what regulations might come down from Washington. Now, 2 basic ways to build social capital: brokerage and closure. One of the books I drew upon was Ronald Burt, the University of Chicago sociologist, who wrote Brokerage and Closure, an introduction. Is where you bridge connections and information flows across different groups. That is what this meeting is about. That is why I think I did not appreciate it until I got here last night that Northwell has put together people from all different sectors in the hopes that we're going to interact with each other and we're going to share information and come away with ideas and work together. And we're going to broaden the idea of who we are. That is actually the brilliance of this meeting, which I did not appreciate beforehand. But then there's closure. We go back and we're going to nail it down. We're going to standardize. We are all going to screen people for social determinants. We are all going to treat people with respect. So this can be done. It doesn't take, it is more, as I said, more important than the finances. There is stuff to be learned from other countries beside. And on the right here, I'm the editor of this publication, New England, and NEJM Catalyst, New England Journal spinoff on value and healthcare delivery. We've got an article in process from the Netherlands, which they are organizing what they call precautionary circles. I'm not going to try to pronounce it in Dutch for you, but they're organizing groups of people, 10 to 15 people, who agree to help each other out. Like if you need to get up on a ladder to hang up a picture, someone will hold the ladder for you. Because in modern society, people just don't have those relationships anymore. And they're finding in their early work with this that people feel better. It actually seems to be associated with lower healthcare spending. In Singapore, patients with chronic heart disease are being asked 3 questions routinely. This is standard. This is high reliability functioning. They get asked, what is a good life to you? And then they're asked, how can you use your strengths and skills to meet your goals? It's about empowerment, not just about we're going to give you, this, vasodilator or something. And then how can your family, friends, and community support you in meeting your goals? They are asking this in every single care interaction for people with heart failure in Singapore. There are American things that are great too. Like I was just in the villages. I've spent 3 trips to the villages recently, and I know there's laughter because you're thinking they're not completely accurately known for being a lot of right-wing supporters and having a frisky social lives. Neither of those things is completely true, but they have a social fabric. They have extremely low use of non-acute care facilities. When people come out of the hospital, they don't go to a SNF, they go home, and their neighbors take care of them. When 1,300 people in the villages were made homeless because a tornado ripped through the villages about 7 or 8 years ago, not one person spent a night in a hotel. They took care of each other. So this is what I mean about social capital has implications for health and healthcare costs. All right, so I'm going to show you, this is like my one data slide. This is from my colleagues at Press Ganey. We measure how employees feel. We measure how patients feel. And when you ask employees their level of agreement with the statement, this organization treats me with respect, and you put them in the quartiles on the x-axis, and then you ask patients on the y-axis, like, how do you feel about your care? And you find a strong correlation. I have like many slides like this, and I only put up this example to show you that our data overwhelmingly, completely, without exception, show that good things in the human experience go with other good things in the human experience. That when there are no trade-offs in terms of what people want and what makes people proud and what makes people happy. That if we do a better job with patients, we're not going to be paying a price with employees who are less happy. They will be more happy if we do it. There is such a thing as excellence, and that is what we're going for. And I think that, what I think that Michael Dowling and the Northwell leadership have been about is showing that doing the right thing is the right thing. So how do we go about doing it? As I said, I've got a ton of data that make that simple point. It's not idealistic. It's confirmed by data. All right, so how do we actually go about building social capital? And even though I've got this book coming out, I didn't come up with any of these ideas. I'm sort of like a broker bringing them from other books and other thinkers from outside healthcare. And I'm not going to, I'm just going to say these are books that are terrific and that I drew upon very, very heavily. But I'm going to just summarize the takeaway insights from them. I think that you can think about your work in building social capital as 3 basic functions. You've got to build connections with people, and then you've got to strengthen those connections so they're really meaningful. This is with people you work with. This is with people you're helping take care of, and their friends and their family members. And the reason you're doing it is not just to be nice, but the reason you want to do it is because you need to transmit the right values across those connections. And if the connections exist and those connections are strong, then the information flows, the values flow. And there can be values like, we're all going to have dessert, and that's why people gain weight together. But they can be values like we're going to treat people with respect. Nick Christakis, who's been my great tutor in this stuff, he points out that social networks are agnostic. They can spread bad values, they can spread good things, they can spread anti-Semitism, racism, but they can spread charitable giving and so on. Unfortunately, bad things spread faster and more readily across social networks than good things. And what that means is we have to really work and be very conscious about spreading the right values within healthcare organizations and with our patients and their family members, because we just can't take it for granted that they will spread because they're the right thing to do. So then we've got to strengthen those connections. And here I'm kind of thinking mainly about within the healthcare workforce. You can generalize it beyond that, but I think it's critical that within healthcare organizations that we have really strong connections so that the norms have meaning, so that people do not want to lose their relationship with their colleagues because they're violating the norm. So the connections won't be real unless people are treated with respect. So what's it mean to have a culture of respect? That's something a lot of organizations are really turning to these days. People have to be proud of what they're doing, and people have to trust that their colleagues are going to have their back, for example. The way you make this kind of thing happen systematically is you need like an operating system. You need to round. The way we round on patients, a lot of organizations are figuring out we have to round on the people reporting to us, not just talk to the people we like. I mean, I think every manager is vulnerable to that, but making sure that, audit yourself. Like two basic things I'd say is every manager should round on 2 of their people every day and ask, and basically the 3 questions that in an audit, like have you actually had have you had a meaningful interaction? Did you talk about the goals of the group? And did you talk about something personal for them? And if you haven't done that in 2 or 3 weeks, then you got to fix it. Reciprocity is spreading norms that this will. Like when I started my internship, in the first week, my resident said, "You never say no to a fellow intern here." And I was taken aback, but it was nice. Things go more quickly and easily when your people are going to say yes without needing to know the details. Now, bonding interactions, Putnam talks about, again, that's what we're doing, that's what we're doing within groups, where Putnam calls it the super glue. You've got to have teams with psychological safety where people can speak up. Amy Edmondson's data show that more diverse teams are not better than homogeneous teams unless there's psychological safety. If there is psychological safety, they outperform homogeneous teams. If there isn't psychological safety, they're actually worse. So you've got to have that culture within teams. Putnam calls it thick trust, and where you can see everyone, you know what they're doing. Bridging connections, Putnam calls this the WD-40 of interactions. This is where you broaden group connections. Like after a day of the interactions we've been having, I think there are relationships here where people are ready to trust people that they've never worked with before. That's thin trust, and it accelerates learning. So you need super glue, you need WD-40. I think that's responsible for most of our successful home repair things, and that's part of management as well. Now I'm going to skip ahead and skip the team stuff, and I'm going to skip the social capital for patients, but I just want to end with this. Like, what does it mean for as managers to actually try to take norms and make them stick and make them change your performance? And I know that Michael will often bring up things from Irish culture. When I got the podium, I'm going to bring up something from Chinese culture. I'm Chinese American, born here, but raised by parents who very much were not. And so I just want to, I think that rituals are worth considering very briefly. Like when we think about what do we want to have happen, turning them into rituals. What will be the rituals and the norms that we have? And Confucius was a philosopher who lived like 3,000, not quite 3,000 years ago. And Western philosophers often believe in rules, like, Immanuel Kant, you should never lie, even if it will save someone's life. Confucius was more in the mindset of life is complex and it's hard to come up with rules that are the right thing for every situation. But he believed in the power of rituals. So rituals are where you behave as if you are the way you should be in these frequent, regular, recurring events. So that, for example, like an older person comes in the room, you stand up as if you're respectful. A patient is lying in a bed, you sit down as if you're respectful. You greet colleagues by name, you thank them when they've done their work as if you're respectful. And what Confucius believed is that if we behave as if we are the way we should be at these frequent, regularly occurring events with 100% reliability, it hones our instincts so that we are more likely to be that way in the vast gray zones in between that make up life. And the last thing I'll say is Confucius also believed that it's not just the person you're doing this for that benefits, you benefit. You feel more noble if you are behaving as if you are the way you should be at these rituals. So what I would say, as we develop our metrics to pursue our goals, we should be thinking about what are our norms and rituals that we want to make part of being in our social networks and make them stick by having strong social networks. So with that, let me turn the stage on back and we'll